I want to talk to you a little bit about cervical spine surgery. Sometimes when patients have severe or chronic neck and or arm pain, or they have weakness in their arms, or they have tightness in their spinal cord that's so severe they can't walk or ambulate, or they're having difficulties with their neurological functions, we have to do something in their neck to get the pressure off the spinal cord or the nerves. And those types of procedures really kind of come in two different main broad categories. The first one is an anterior cervical spine surgery. And what that means is we're going to go in from the front. So the anterior side of the spine is actually the front of the neck. So it's in the front of the neck, the anterior side. And this is a model of the cervical spine, like one section of the cervical spine. So we have a bone, a disc, and then another bone. And the disc here is represented as red. And then we have the nerve coming out the hole here through the foramen. And oftentimes with trauma or wearing out of the disc, we call that degenerative disease, the disc will actually become flattened. And so as it flattens, it'll start to possibly bulge and irritate that nerve where it's coming out. So when it irritates that nerve, that's what causes the deficit, or it can irritate or push on the spinal cord directly in the back. And that'll cause deficits in your hands and or your feet. And by deficit, I mean like maybe it's not strong, or you have numbness, or it doesn't really move like you want it to, or you don't know where it is. Those are all neurological deficits. Those are signs of neurological deficits. And so if it's doing that and it's causing pressure and we decide to go to the operating room, then we can go in there and take the pressure off from the front. And that's called an anterior spine surgery. And the way we do that is move everything out of the way. And then we just take the disc out, and at the same time, open it up nice and big and get the pressure off the nerve and restore the space, restore the balance to the spine. And then we put a little block in there from the front, some screws, and then we fuse it there so it doesn't ever pinch that nerve again. And that's called an anterior cervical spine surgery. You can do the same thing from the back of the spine. So sometimes if the pressure is very specifically on the back side of the spine, we can go in from the back side of the spine, and that's called a posterior cervical spine surgery. And we'll go in there and take the pressure off the nerves by removing some of this bone or some of the other elements that are compressing the spinal cord. And then we'll also put some little screws in there to help hold it so it doesn't ever push on those nerves again. So that's called a posterior cervical spine surgery. So in general, like the two broad categories for cervical spine surgery is either we're going to go from the front, which is anterior, or we're going to go from the back, and that's called posterior. And now you're on your way to becoming a spine surgeon.